Welcome back. New research finds high levels of maternal stress are linked to behavioral problems for some children. The study found that psychological distress during pregnancy raised the risk for aggressive and impulsive behaviors for offsprings during childhood and teen years. Doctors say this finding highlights the need for more accessible mental health care and support for pregnant women. And a new report from the CDC and World Health Organization shows measles cases and deaths are rising significantly. It's all happening since 2021. Doctors say the increases are not unexpected because vaccination rates for the measles have been dropping. They hope this report will motivate more people to get the measles vaccine. And flu season is here, and we know the virus can make people very sick, including children. New research shows despite recommendations, many children at high risk of flu complications are not receiving treatment. Michael George explains in today's Medical Minute.
Antiviral treatments can make the flu less severe in children, but new research in the journal Pediatrics shows less than 2/3 with a flu diagnosis receive the medication.
I think it's important for parents to be aware that these antivirals exist, that they're safe and that they're effective, and that they may be helpful for their children.
Study author Dr. James Antone with Vanderbilt University Medical Center says when taken within 2 days, antivirals can shorten the duration of symptoms by about a day. Oseltamivir, or Tamiflu, is approved for children under 5 and is also recommended for all age groups. National guidelines say all children under 2 should get an antiviral, but the findings show just 37% are prescribed the treatment.
We know that these antivirals can prevent hospitalizations and complications in this very vulnerable age group. We know that children less than 2 have poor influenza outcomes compared to older children and adults.
Flu activity remains low nationally, but is picking up. Doctors say antivirals can also help prevent transmission.
There can be some side effects.
For the most commonly prescribed antiviral, oseltamivir, it can cause a little bit more vomiting than children who don't have it. And there's a warning on the label for neuropsychiatric events. These events are very uncommon. It seems that both providers and parents seem to think they work less well than they actually do and have more side effects than they actually do.
Dr. Antone encourages parents to have a conversation with their pediatrician. Michael George, CBS News.